Say well done and thanks to the Westminster Committee for their energy and commitment over the past year. We continue post-election with a strong committee to carry out the work programme ahead, so that's good news, and thank you. And I have the privilege of working with Richard as the Vice Chair of the Westminster Committee. Paul Wilson, our former Chair, keeps homelessness in the spotlight on Channel 4 and the radio. An important report is also considered by the Health and Wellbeing Board with actions for change, because at the end of the day it's obviously about changing things for the better. We're working on a potential closure of 3 GP practices in Westminster, and Healthwatch is supporting the patient voice in influencing what happens next. Westminster Healthwatch leads on the relationship with Imperial College Healthcare Trust, given their main site is in the same area as in Paddington. And we've been holding the trust to account by the Dignity Champion assessments, the entrant view, so that's a way of actually really seeing what's happening in that hospital, and also raising concerns on behalf of patients. Moving on to hospital discharge. This is something that's very close to my heart. As a very young and enthusiastic social worker, medical social worker, I remember supporting an elderly man who was facing terminal illness and was very dismayed by the lack of discharge planning on his behalf, and in fact provided some support for him post-discharge off my own initiative. I think it's concerning that I find that some of the same things are emerging now in terms of concerns about hospital discharge. And we know that this is of particular interest to our membership and how important this stage of recovery is to people who are making that transition from being in hospital to going home. We found that there's limited awareness of what effective discharge planning looks like. And it's certainly not happening consistently within 48 hours of admission. The earlier you start, obviously, it's easier then to make secure arrangements for discharge. There's insufficient mobilisation or organisation of patients to prepare for discharge so that people are ready for that important step. We find that discharge dates and times change, making planning difficult, and we know what impact that uncertainty has for people who are making that step. There are poor access to medication, which causes further delays. There's nothing worse than sitting around for your medication to be available before you can go home. Long waits for transport. Actually, physically getting out of the hospital and to home is frustrating if you're waiting for your transport to arrive. There's also evidence of poor communication with friends and family. Friends and family are a very important part of supporting people at home, and that communication is essential. There's limited information about sources of further help if there are problems post-discharge, and patchy links with outpatients and GP practices, so that there's that, I don't say a seamless transition, because in my view it's like the dress I'm wearing, it's kind of what holds the dress together, it's the connections that people make. And there are particular challenges for people, patients and people with mental health needs. We've heard from Ivan about mental health issues, learning disabilities, we've heard from Richard, and those who are older and or homeless. So they're all groups that really need particular attention and special attention. What's happening next? Well, we have the opportunity to contribute to Healthwatch England's special inquiry, working on whole systems integrated care. This is the approach, a joined-up approach to health and social care, and putting patients at the centre. That's what is being promoted, and hopefully we can make a reality, help to make a reality. And Paul Wilson and Paula Murphy, our director, are on the case. They're going to be contributing to that inquiry, so it's good to know that we'll be having a direct input. So I'd like again to reinforce my thanks to the Westminster Committee and hand over to Patricia, who's going to talk more about the dementia work stream.